Let the words of my mouth and the meditation of my heart be acceptable in thy sight, O Lord, my strength and my Redeemer. Hallelujah. Mr. Speaker, as I rise to make my second contribution to the sectoral debates as spokesperson on health, I must pause at the outset to pay homage to the leader of the opposition for entrusting me to provide scrutiny for this a most critical ministry and to offer practical solutions for complex problems. I want to thank my family for the sacrifices they make in order for me to serve. It has not always been easy, but the fire burns inside to leave a better country than the one we have today for my three little children. This, Mr. Speaker, continues to be a mission centered around the outcome and not the income. I want to thank my colleagues here in this House, on both sides, who offer a quiet word of encouragement at appropriate times. Mr. Speaker, I'm sure you will agree with me as I pause to acknowledge the team from Northwest Centre who know how to get things done in and out of government. And also the constituents. They are still not willing to gamble, but will continue to stick with Campbell. They've asked me, sir, to take a message to you, Mr. Speaker, and the entire nation, a message that speaks to the power of the dream. Mr. Speaker, last but most importantly, I want to thank my Lord and Savior for his unfettered love and mercies. Yes. Mr. Speaker, intently I listened to the presentation of the Minister of Health and Wellness. The Minister has been tardy with his interventions. Tardy, Mr. Speaker, as the tenets of his intervention were presented to him when he became Minister, and he is yet to execute them. Mr. Speaker, a shared vision for health care in Jamaica is noted as far back as when Dr. Fenton Ferguson was Minister. The shared vision included healthy lifestyle, universal access to affordable health care for all Jamaicans, a digitized health record system, tobacco control, compassionate care towards our people, and the importance of primary health care. These are factors that will take us towards attaining the Sustainable Development Goals of 2030. Mr. Speaker, this we can agree underpin the rubric for health care in any population, and more so for an aging one. Mr. Speaker, the Minister took pains to define by the WHO standard the definition of health. The definition speaks for itself, but what might be lost on the Minister is the essence of some part of same definition. Mr. Speaker, the budget for health is anemic, far removed from 6 to 9% of GDP which is required. This, though, Mr. Speaker, is no excuse for the challenges faced by our people daily and the tardy intervention. Mr. Speaker, the health sector has always been stretched. We have a sector that is significantly underfunded. This problem has clearly been made worse by the free healthcare policy. The free healthcare policy was and remains a Pyrrhic political victory, and despite the adverse effect, there is no will to rescind strictly based on political calculations. Mr. Speaker, when the now Minister was on a sabbatical, he did a study with Caribbean Research Policy Institute, CAPRI, which spoke to the ill effects of the policy. So I'm confident that it is clear to him as to those effects. The staff, they are overworked and underpaid, leaving very little room for motivation. There's overcrowding in the facilities, limited bed space, lack of resources leading to unavailable diagnostics, old and non-functioning equipment, etc., etc., etc. Mr. Speaker, it was this government that removed the infrastructure from the hospitals to facilitate the payments. I have long spoken about the need to collect from the insured. I am happy to hear of the belated announcement by the Minister to do so. Cornwall Regional Hospital used to rake in millions per month from collecting for the visit, the diagnostic, whether they are laboratory or radiologic, the therapeutic, including the pharmaceutical services. What has been happening is that the government is subsidizing the insurance company as monies are collected and premiums either remain unchanged or are still increasing annually. Mr. Speaker, there needs to be a relook on how we fund healthcare. There are 5 main models for healthcare. The first is a tax-funded model, funded by taxes and compulsory contribution. This system is provided by the government. This is what happens in the UK with the NHS. Then there is the employment-based insurance model, a non-profit insurance system funded by members and workers through pay deductions. It covers everyone, and this system is used in Germany, France, and Japan. Then there is the national health insurance model, a cost-effective combination of private sector and government insurance funding, as seen in Canada. Then you have the private insurance model, where funding is based on premiums and provided by private insurance companies. This exists in the US. Mr. Speaker, the 5th model is the out-of-pocket model, where you pay at the point of use. This offers medical services with no centralized funding. Mr. Speaker, Jamaica has options. The substandard service and care that obtains today is not acceptable. Better can and should be done. We will look at Jamaica Moves. Mr. Speaker, this initiative is the flagship of the minister's administration. Let me commend the minister for taking this idea that was in the ministry at the point in time where he became the minister, and he has added the necessary PR component to it and taken it to the people. It is a good program, and we support it 100%. Let us recognize, though, whose brainchild the program was and commend them as we commend the minister for an excellent leg in the relay. Mr. Speaker, none of these planks, Mr. Speaker, in his presentation, the minister provided 3 planks for his intervention. None of these planks are new to us. The 10-year strategic plan. In his last presentation as Minister of Health, the former minister, Dr. Fenton Ferguson, tabled in this honorable house the 10-year strategic plan. A plan agreed to and funded by the IDB. A plan at the time was already on the books, was also tabled by this minister in his first presentation. It has been there for 3 years, and the plan, Mr. Speaker, is still a plan. Nothing has been done to activate it. Work and consultation was done on this plan and is yet to be seen. Mr. Speaker, these delays have affected the quality of care in the island's public hospitals and health centers. This delay has left many health facilities short on supplies. This tardy intervention of enacting this plan has led, as we say in medicine, to complicated sequelae. While we celebrate Jamaica Moves, healthcare has not been moving. If the minister recognizes that 1 in every 3 Jamaicans in this aging population is suffering from a non-communicable disease, then it behoves him to implement policies that addresses the curative side of healthcare and not concentrate solely on the lifestyle changes. Mr. Speaker, while exercise and diet can help in the control of these illnesses, too many clinics and hospitals are short of the necessary curative agents to treat patients. Intervention is needed here. Mr. Speaker, the minister puts primary health care at the forefront of the 10-year plan, but we in opposition already knew this. It was by design that the 10-year plan, as was developed under the previous administration, saw primary health care importance and positioned it as such. But, Mr. Speaker, how can we ask people to trust and use these health centers if they are always woefully lacking basic supplies? Just last week, a child received a cut to the forehead and went to the St. Anne's Bay Hospital. The doctors compassionately told the parents that the child needed to be sutured. but the child had to go home because there was no suture in the hospital.
That's poor.
Now, Mr. Speaker, can you believe that? In a public hospital, a child receives a laceration, goes to the hospital to have attention paid to them, and are told to get it stitched up. Stitch up in plain, simple terms, to get it stitched up. And they are told by the staff at the hospital that the only thing that they can do at this point in time is to dress it. The child should go home and return the next day in order for the wound to be sutured.
Shame. Shame.
That's Sentence Bay Hospital. We're going to ask, somebody may ask the question, why not take the child to the nearby health center for the suture as opposed to the hospital? The answer is they know the health center will have no supplies because there has been no intervention. Mr. Speaker, we have fallen from grace. In 1978 at the Global Conference on Primary Health Care in Russia, Jamaica was a leader in primary health care. Fast forward to now and our people don't even want to go to the health centers. A lot of the overcrowding at hospitals are due to the absence of any quality in the primary health care system. When I say quality, let it not be said that I'm referring to our medical staff, as they are first class. The quality I speak of is the absence of basic amenities in the clinics. Mr. Speaker, is the intervention plan for this minister to turn health centers into Jamaica Moves locations? Let us not even begin to mention the reclassification of health centers. This was started under the previous administration, and the minister keeps bringing it back to this honorable house as a plan. It needs some intervention. Mr. Speaker, good intervention in healthcare must be timely and have the desired effect. Mr. Speaker, the minister speaks of accessibility to healthcare. There can be no value to accessibility without equity. Opening the doors is not accessibility. Mr. Speaker, let me give you examples of equity. Equity is the setting up of 2 cancer centers of excellence to remove the cost of modern radiation treatment to the people of Jamaica, moving the cost from $2.5 million to $0. This intervention was done by the previous administration. In his green paper on health insurance, on the health insurance scheme, in the analysis, quoted our figures of the out-of-pocket expenses for healthcare in Jamaica. The minister speaks to the benchmark of 20% as a safe number, while that in Jamaica is 28%. The document further states that out-of-pocket of over 20% increases the risk of catastrophic healthcare spending and impoverishment due to episodes of illness. It is for this very fact that equity is needed in the health sector to prevent the sequelae of chronic illnesses. Mr. Speaker, if the minister is armed with all these facts, then why has the strategic plan not been executed yet? Where is the intervention? The National Health Insurance Scheme is the second plank that the minister spoke about. The last administration recognized the need for a national health insurance scheme. At the time of the meeting office, there was a platform developed at NHF with 400 registered members. It was named the Government of Jamaica Health Insurance Plan. Mr. Speaker, the minister shelved that plan and sought consultation with U.S. companies. I've already outlined the different models that are available, and we will have further debates on that in this very house. Really major capital expenditure. Mr. Speaker, with an anemic healthcare budget, we welcome any expenditure that is to be made in healthcare. Our plants suffer from the need for upgrades and maintenance. The proposed $1 billion initiative to help remove or reduce the wait for surgeries is admirable, but we must question this spend. The problem that it seeks to remedy is that of long waiting hours and unavailable or inadequate access to diagnostics. Mr. Speaker, to my knowledge, the Ministry of Health has a MOU with the providers of diagnostic tests in place already. The expansion of this aspect is welcome. However, the grey area is in the provision of surgical services. Mr. Speaker, there are ethical concerns. The question is, will the same doctors in the public sector be the ones to do the surgeries in the public-private partnership? How do we ensure that the people are not channeling the hospital work into their private practices? How will the post-operation care be carried out? When these surgeries are done, will these patients be sent to the public ward? Mr. Speaker, the government is on a campaign to divest all sectors. Is this happening in health too? This seems like a divestment of health care for the poor and vulnerable to me. A divestment, Mr. Speaker, that has the potential to be exploited by a few. There is limited accountability in the public health sector. Do we have an audit of when doctors arrive or leave the hospitals? Won't these doctors leave even earlier to get the private money? What incentives will doctors have to do the hospital work if they can go to the private session and make a sessional rate? Mr. Speaker, if this $1 billion is available, why can't it be used to improve specific surgical centers in the public system to carry out these surgeries?
Good question.
At most of our major hospitals with multiple operating theaters at night, only one theater is used. Why don't we get the additional staff to ensure that one team is dealing with on-call and another team is dealing with the cases to reduce the waiting list? That seems like a very practical solution to me. The approach, Mr. Speaker, to strengthen the public care system seems like the intervention that should be pursued. Doctors employed with the government, Mr. Speaker, should only be allowed to do private cases after 4 p.m. or on weekends. Mr. Speaker, doctors who are employed with the government should only be allowed to do their private cases after 4 p.m. or on weekends. Not even in the night, because I'm saying we should put 2 teams for the night. The on-call team and one called dealing with the backlog. Mr. Speaker, the government could have public cases done on weekends in private facilities, with them also improving the service in the public system. Mr. Speaker, long waiting times are a global problem. So it would be prudent to look at what are the rate limiting steps in getting surgeries done in Jamaica. Time and because sort of other technical private. Mr. Speaker, you have instruments not working. You have non-functioning ACs, as was the case yesterday at KPH. The ACs were not working and they had to cancel the list. You have no lights.
Time is so hot.
Can you imagine? You have persons going for surgeries and they can't get the surgeries done because there is no light in the KPH a week ago because they didn't have the appropriate anesthetic drugs. You have problems with the pre-op preparation of the patient. They don't have ECGs. They don't have the necessary radiologic services. Mr. Speaker, it is clear to me that if you're going to spend $1 billion, you should spend it to improve on the public health care system to deliver the clinical. You have personnel issues. What you have is that you have doctors who arrive late to work and they leave early, so you don't get the necessary surgical work done. There's a lack of accountability, and you have private cases being done on the government's time.
Wrong.
It's the people we're talking about. The patient issues. You have some persons the inability, they cannot afford, and is sitting in the hospital for weeks until the family can sell goat, cow and everybody to get the money to buy the implant. Had it been that we were providing those implants, that person could get the surgery done the next day and be out of the hospital in 2 days. So that's it. That's how you manage the sector. This thing about just PR and talking and running around is not getting the impact in the sector. It will not be fixed for the masses. Some doctors will be richer, but the health sector will be poorer. I am sorry, sir, but I support better quality for the masses and not just a selected few. Fixing the healthcare system must be our aim. I want the system fixed for the small Jamaicans. The policy I will support must do that. Mr. Speaker, the minister speaks about 100 that cannot get their prescription. Spent $2,567 Jamaican dollars at JugServe. As of the 1st of this month, she has now to spend $14,000 for the same prescription.
What a jump.
Who is it that the government is protecting? The pharmacists or the poor people of this country? $1 million.
More pestilence.
Mr. Speaker, no plan for the future can exist without a special look at public health. While we welcome increased surveillance and eradication, special attention and funding must be allocated to research, funding field activities, and laboratory upgrade. Critical. We can't keep sending these samples to Carrefour. We're taking over 2 weeks before. We should be able to do the test right here. We called for this in the time of Zika, and we are repeating the call again. Although we have porous borders, the minister and the ministry must work to improve surveillance at the ports of entry and increase staff to man these areas. Mr. Speaker, whilst the population has a responsibility to maintain a clean society, the ministry must be proactive. The danger of being reactive recently manifested in the minister's tardy approach to the presence of the dengue hemorrhagic fever. Mr. Speaker, I was flabbergasted to watch the minister's presentation and not see one mention of measles. There is an outbreak in the States and parts of Europe, and the country was belatedly placed on a measles watch. Yes. We must continue to encourage immunization, especially seeing that MMR1 has fallen to 89% and MMR2 to 82%. We must continue to assure parents of the benefit of vaccination. The HPV vaccine has also hit a roadblock. This again is due to a lack of a proper public education program and the relevant coordination between the Ministry of Health and the Ministry of Education. Yes. Cervical cancer can be prevented, and thus we should double down on efforts to inform and encourage parents. Yes. Mr. Speaker, our hospitals really and truly should only be seeing persons for accidents and emergencies and those who are referred for specialized care. Every other patient can and should be seen at a health center. This will drastically decrease the overcrowding and long waiting time in hospitals. Plus, it is way cheaper to offer the care in the primary facilities as opposed to the secondary or tertiary facilities. Mr. Speaker, there is clearly a crisis regarding bed space. Far too many of our brothers and sisters end up at a hospital without a bed to accommodate them, even after being admitted. It is a crying shame. Mr. Speaker, if people think that I am just making this up, the 27th of April this year, Jamaica Observer, 94 years old man, spends day without bed in public hospital. The 28th of January 2019, Jamaica Gleaner, Maypen patients still sleeping in wheelchairs. Doctors renew call for ease of the condition. The 14th of April this year, Jamaica Gleaner again, expectant mothers, and this one is the worst of the lot, Mr. Speaker. Expectant mothers forced to carry childbirth supplies. This is the state of the sector. This is not me. I'm just reporting the news. But somehow an impression is being given by especially those persons who do not use the public health sector, that everything is fine and that somehow a wonderful job is being done. It is not true, Mr. Speaker. In addition to switching the focus to primary care, there is a clear need to build more bed space. Again, I'm happy to hear that we are finally relocating the social cases. This is something that I spoke about last year as well in my presentation. Mr. Speaker, it should be noted that some of these cases are due to mental illnesses, and thus the refusal of the family, or I dare say the inability to care for some of them. Mr. Speaker, I now turn to mental health. Mental illness is no joke, and we must place greater emphasis on providing care to those who suffer from it.
Sufficient time to finish.
I knew this day would come, but Mr. Speaker, I ask that the member time be extended sufficient to enable him to complete his.
I will.
Those in favor? Aye. Those against? Mr. Campbell.
Thank you very much, Mr. Speaker. Thank you, Leader of Government Business, and thank you, colleagues. I won't abuse it. But, Mr. Speaker, mental illness is no joke, and we must place greater emphasis on providing care to those who suffer from it, even the ones who sit in this House. Mental illness may result in suicide. Oftentimes, those oppose it to me accuse me of politicizing health. But let me draw your attention, Mr. Speaker, to two articles. The first, published on May 4, 2014, and that was in the Jamaica Observer. This article here, seated the member from Northeast Manchester, Audley Shaw, the Minister of Youth, of Gender and Culture, Babsy Grange, the Minister of National Security, Dr. Chang, who should know better, and the Prime Minister. This is May 4, 2014. What? And in this article, those members' names said that the suicide rate in the country was going up because of the harsh economic times.
Shame.
That's what they said, including a medical doctor who was seated there. Here's the article. Right? They didn't say anything whilst they were in opposition. Right? That it was harsh economic times driving up suicide. Now, Mr. Speaker, the second article, published May 11, 2019, 100% increase in suicide.
Wow.
100% increase in suicide. That is what the politicization of serious issues look like. And I will never sojourn down that road. Never sojourn down that road, Mr. Speaker. That's not what we are about on this side. I stand here calling for greater intervention where mental health is concerned. Mental illness is a clear and present danger. The stigma attached to seeking help is a deterrent as well as to the accessibility of meaningful support. A mental health policy framework and strategic plan was developed by the previous administration along with proposed amendments to the Mental Health Act. Again, the minister has been tardy in his intervention. Since our administration retrofitted the lower floor of the medical ward at KPH, I'm yet to hear of any intervention to make hospitals more prepared to deal with mental health cases. Mr. Speaker, I will quote my colleague, the member from Northern Clarendon, Horace Daly, in his presentation on this matter, when he says, and I quote, "Minister, there is no need to remarket this.
True. You don't need to remarket mental health.
End quote.
Just do it. Do what you have to do. Do the prevention.
Staff shortage. Mr. Speaker, with the minister's approach to healthcare, our world-recognized healthcare workers are leaving our shores. Between September 2018 and January 2019, more than 50 nurses have resigned from the St. Anne's Hospital to take up positions overseas.
One hospital.
And that again is an article from the Jamaica Gleaner. Between September 2018 and January 2019, 50 nurses have resigned from the St. Anne's Bay Hospital to take up positions elsewhere. The working conditions have deteriorated and the wages have not improved, so the attrition rate continues to rise. Mr. Speaker, there is a need to revisit the cadre of nurses and doctors at the health facilities. There needs to be an increase in the number of staff so as to save them from exhaustion and burnout. While I don't condone callous, rude behavior from our healthcare professionals, their working conditions have made them numb, and thus they can come across as inhumane at times. Mr. Speaker, we on this side continue to advocate for livable wages for our healthcare workers. HIV and AIDS, Mr. Speaker. Great strides have been made in addressing HIV in Jamaica. While we have managed to reduce the transmission over the years, the stigma still remains. Mr. Speaker, let it be recorded that we are willing to work with the Minister and his excellent PR approach to continue to fight this stigmatization. While we have excelled in the control of the transmission, it has been recognized. And the downside of the recognition of our dedicated healthcare workers is the reduction in the international subsidy that we get to fight against HIV and AIDS. I implore the Minister to make an intervention and increase the budgetary allocation for the continued fight against HIV so that we don't lose the gains that we've had in the past. Mr. Speaker, with all that said, the old adage that prevention is better than cure still rings true. There can be no real change in the delivery of healthcare without a stronger focus on primary healthcare, both in regards to infrastructure and personnel. I was happy to hear the Minister that he took the suggestion that I made last year, that after internship, the doctor should spend a year in the health centers. This to ensure that all the health centers in the country will always have a doctor in there so that persons in the community can go to the health center as opposed to seek care at a hospital. But I can tell you this, Mr. Speaker, he didn't speak to the second part of my recommendation, because if he proposes it as that and nothing else, there's going to be open rebellion, because those persons now will earn less than the intern who is then doing 10 duties. So the salary must move with that mandatory request of the SHOs. It must be that you equate their salaries to them working in the hospital and doing an average 10 duties per month. If you were to do that and incentivize persons working in the health centers, then, Mr. Speaker, is when we'd really see change in the delivery of health care. Mr. Speaker, I am again pleading on behalf of the people from Runaway Bay and surrounding environs for the health center there to be started. Ground was broken from 2016. Money provided by NHS. It is unfair to have them undergo such inhumane conditions. Just last week I saw a crowd under the almond tree of mothers and fathers with children in hand, at the mercies of the vagaries of weather. They deserve better, Mr. Speaker. And I will not stop advocating that the health center in Runaway Bay must be built. And Mr. Speaker, if the minister does not want to build it, I have a word for the people of Runaway Bay. Wait 1 year till I'm the minister and I'll build it myself. But the money is there. Money is there. Money is there.
Money is there. Yeah.
In closing, Mr. Speaker. In closing, Mr. Speaker. I want to acknowledge the foundations left by the previous administration. Mr. Speaker, were it not for the foundation set, the current minister would be without plans to set healthcare on 3 years later. It speaks to the good work of the former minister, as much as he was chastised by the members opposite. Mr. Speaker, Cancer Centers for Excellence, a PNP intervention. 10-year strategic plan, a PNP intervention. National Health Insurance Plan, a PNP intervention. A 12 billion hospital refurbishing plan, a PNP intervention. Mr. Speaker, the minister must become proactive and ensure that there are timely intervention. We on this side remain committed to working to support any and all initiatives to lead to the advancement of the health sector for the delivery of better health care for the people of Jamaica. Thank you, and God bless you.
You should have added and ready to resume where we left off.
Minister, you can step aside whenever you're ready.
Yes,